natural disasters have a profound effect on today's society. According to this infographic, the impact of natural disasters worldwide, from China to Haiti to Japan, is shown. From the year 2000 to 2011, natural disasters have caused an estimated $1.3 trillion of damage worldwide, affected 2.7 billion individuals, and have killed 1.1 million people, all in the time span of 12 years. Furthermore, according to the United Brain Association, 25% of the people who are impacted by natural disasters could be diagnosed with symptoms of PTSD. Good morning. My name is Arjun Nanduri, and today I'll be speaking about how to treat the PTSD symptoms of natural disaster survivors. Considering the damage natural disasters leave in their wake, it is important to facilitate recovery of damaged countries to pre-disaster levels of productivity. To do so, the mental afflictions brought upon by natural disasters must be solved. As such, the following question can be asked. What is the best method of treating the PTSD of natural disaster survivors? Through thorough research, it has been concluded that the best method of treating the PTSD in natural disaster survivors is through professional therapies. One solution to the PTSD in natural disaster survivors is using media as treatment. According to a study conducted by Florida State University, after the landfall of Hurricane Michael in 2018, it was shown that post-hurricane self-transcendent media use, along with support-seeking coping, was positively correlated with post-traumatic growth. For example, in China, after Typhoon Hatal, the University of Macau found that images related to heroic acts and information about the storm was related to low odds of PTSD. With the reach that media possesses, if positively connotated media is widespread after a country faces natural disaster, it is likely that people's odds of suffering from symptoms of PTSD can be reduced. There are, however, a few problems with this solution. For example, it was found that hedonic media use was positively correlated with PTSD symptoms. Considering the widespread nature of media and its uncontrollable nature, there is no guarantee that all media usage by natural disaster survivors will be positive and can instead exacerbate their symptoms of PTSD. This is a problem. Another solution to the PTSD in natural disaster survivors is through the development of faith. According to the article, in their own words, Resilience Among Haitian Survivors of the 2010 Earthquake, after the widespread destruction caused by the 2010 Haitian earthquake, as seen here, the earthquake survivors attributed their hope and motivation to that of a higher power. Their faith was an intrinsic part of their ability to continue forward despite their adverse circumstances, allowing the resilience to suppress their symptoms of PTSD. If faith is widespread in countries like Haiti, it can allow people to use their faith to suppress their impacts of PTSD, allowing their country to recover to pre-disaster levels of productivity. Furthermore, according to a study published in the Journal of Positive Psychology, other types of natural disasters, like the 2017 Mocha landslide in Colombia, revealed that survivors' trauma contributed to higher positive religious coping, which resulted in greater dispositional forgiveness, hope, and overall well-being. This means that if faith is introduced to other countries like Colombia, it can be used as a coping mechanism and allow people's stress as a result of PTSD to be reduced. There are, however, a few problems with this method. For example, those who are struck by natural disasters can develop negative religious coping, such as having negative views of a higher power or blaming God for the current circumstances. If faith is promoted in a region struck by natural disaster, there is a possibility that individuals may develop negative religious coping, which can exacerbate their symptoms of PTSD. This is a huge problem. Another solution to the PTSD of natural disaster survivors is through professional therapy, such as EMDR therapy and CBT therapy. According to this infographic, EMDR therapy treats symptoms related to trauma and PTSD and has a success rate of 80 to 90% in comparison to traditional therapies such as talk therapy. This means that EMDR therapy can be used reliably and on a consistent basis to treat PTSD. Furthermore, considering that professional therapies are conducted by licensed professionals with years of training, it is more reliable as a treatment as opposed to media and religiosity. Furthermore, according to Francine Shapiro in the Journal of EMDR Practice and Research, humanitarian assistance organizations have conducted projects internationally to provide EMDR treatment after both man-made and natural disasters. This means that there are already prior precedents of using EMDR therapy to treat the symptoms of PTSD in other countries. Thus, it is a viable solution to the PTSD and natural disaster survivors. There are, however, a few limitations to the use of professional therapies as a treatment for the PTSD of natural disaster survivors. For example, the high cost of professional therapies, in contrast to media usage and religiosity, means that the marginalized and low income may not have access to these types of therapies. Furthermore, third world countries like Haiti may not have the resources to train professionals who can administer these treatments. This is a problem. Of all three solutions to the PTSD of natural disaster survivors, the use of professional therapies is by far the best. As previously established, both media and developing religiosity as means of treatment are double-edged swords. Media use is not regulated and can push forward content that can actually exacerbate people's symptoms of PTSD. Religiosity can cause negative religious coping to occur, which can actually harm the user instead. In contrast, although professional therapies may be inaccessible to many, humanitarian aid organizations, such as the UN Central Emergency Fund, can provide EMDR therapy to the marginalized. As such, professional therapies should be considered the best treatment for the PTSD of natural disaster survivors. Thank you. Any questions?
Two questions for you. First up, what information did you need that you weren't able to find, and then how'd you try to find it?
Can you repeat the question, please?
What information did you need but you weren't able to find, and then how did you search for it?
One piece of information that I needed that I wasn't able to find was sources relating to how specific media, such as specific applications like Instagram or TikTok or personal bloggers, may actually impact people's feelings about their experiences after the hurricane and their PTSD experience. I could not find such resources, so I turned to a more broader generalization of the answer in search for media in general.
Okay. And what might be some real-world implications of what you found?
My presentation, my argument is showing that professional therapies is the best method of treating the PTSD of natural disaster survivors. So after a natural disaster strikes, I've concluded that the most efficient method and the best possible way to provide treatment and help a country recover to pre-disaster levels of productivity is through professional therapies like EMDR therapy.